Good morning, dear learners. Today we will talk about different imaging techniques used in medical sciences. These techniques are used to investigate patients with different problems. So, what are these techniques? We will discuss about X-ray, USG, that is ultrasound, CT scan, and MRI. So, we will compare all these techniques in different aspects, like which type of radiation or which type of technology they use, which of them are most economic, which of them are costly, and what is the quality of their scans. So let's begin with X-ray. So all of you have seen this type of X-ray scan which is shown in this figure. So you know that the X-rays are having a frequency range of 30 picohertz to 30 exahertz. That is 30 into 10 to the power 15 hertz to 30 into 10 to the power 18 hertz, having a wavelength of 10 picometer to 10 nanometer. Now what happens when the x-rays are exposed on our body parts? So the x-rays have penetration power but it is not so much that it can penetrate into bones. So the rays which fall on the bones, they are reflected back, and the other rays which don't fall on the bone, they penetrate into the muscles. So in this way you can see the whitish portion is the portion from where the x-rays are reflected back, and the blackish portion is the portion having soft tissue in which the x-rays have penetrated. So this way you can understand. Now the x-rays are having a high frequency range, means in range of petahertz. So they are harmful. They are harmful to our body, so they should not be used frequently because they can cause cancer. Now moving on to the next technique, that is USG or ultrasound. So you know the ultrasound is mainly used to detect the abdominal parts or abdominal uh, cavity, you can say, like uterus, your kidney, ureters, and some other organ. So in this figure you can see that here the pregnancy of a lady is being tested, and in this scan you can see the child is there. So with the help of ultrasound, so you know the range of ultrasound range is just above the audible range of human beings. So the audible range of human beings is 20 hertz to 20,000 hertz or 20 kilohertz, and the range of ultrasound is from 2 megahertz to 18 megahertz. So this type of waves are used in ultrasound. They are not harmful, they don't penetrate much in the tissues, and they don't harm us. So the radiation effect is almost zero in case of USG, so it is not dangerous at all. So it is a very safe means of investigation. Now moving on to CT scan. CT scan is just like X-ray. So you might have seen this type of machine having a cylindrical structure and a cavity inside. So a patient is made to go inside this cavity, and then a powerful X-ray machine rotates around the specific part or specific organ of the patient. So in this way 3D image or 3D X-ray image of the particular organ of that patient is taken. You can see here, and it the CT scan works on the same principle of the X-ray, because these the same X-rays are used here also in the range of 30 picohertz to 30 exahertz. But the main difference is that these X-rays are used in 360 degree, means a 360-degree image of a particular organ is made in this case. And these are also harmful because the X-rays are used, so this scan is also not advisable frequently. Now moving on to the MRI. So you might have seen this machine, MRI machine. It produces a very you can say huge sound, loud sound when it is working. So normally when a patient is made to lie inside this, then he is given ear defenders, or you can say just like earphones. Ear defenders are there so that he cannot listen the noise of this machine. Sometimes a music is played in that headphone, you can say. So this is one of the best scan, you can see. As far as the quality of scan is concerned, you can see here these are the scans made through the MRI. So a three-dimensional cross-sectional image of any organ is made, and most of the times it is used for the brain. Now let us talk about the cost of these scans. So the X-ray is very cheap scan, means it costs 100 to 500 rupees. Then we go for the ultrasound USG. USG cost from 1000 to 3000 rupees. Then we move to CT scan. CT scan costs about the same as the ultrasound, means from 1000 to around 4 to 5000. Then the MRI is most costly. It is least harmful and most costly type of scan. So the MRI costs from 4000 to 20,000 rupees, depending upon the organ or the type of scan you want. Okay, so these are all different type of scans. So let us have an example of a banana which is scanned through different methods. Okay, so this is the original banana. Now this banana is scanned through a X-ray. So you know the X-rays did not penetrate any hard part, okay, any hard tissue. So you can see that the color of this skin is whitish, means most of the X-rays did not penetrate through this banana. Okay, so you will see this type of image. Now let's go to the CT scan, the third image. In this image you can see most of the portion is whitish. Okay, so because CT scan is almost same type of as it is in case of X-ray, but the difference is it produces 360-degree image. So you can see here it is also whitish type of, but when you rotate this, you can rotate this image in 360 degree and you can see the 360-degree view of this banana scan. Now let us go to the MRI, the most advanced type of scan. In the MRI, what happens? A cross-sectional 3D image of this banana or anything is made. So you can see that doctor can go inside this scan, okay, in deep, and he can see the different tissues which are present inside this skin. So it is all about different type of scans. If you like this video, just like, share and subscribe, and thanks for watching. Jai Hind.